Hello, my name is Noreen Shepherd. I'm a MSN student with Lamar University, and I'll be assisting Dr. Sherrod today. Okay, we're going to talk about Chapter 15, assessing. Systematic assessment. Systematic and continuous collection, analysis, validation, and communication of patient data. Data reflects how health functioning is enhanced by health promotion and compromised by illness and injury. Database includes all the pertinent patient information collected by the nurse and other healthcare professionals. The database enables the nurse to partner with patients to develop a comprehensive and effective care plan. Critical thinking activities linked to assessment. Assessing systematically and comprehensively to identify nursing and medical concerns, detecting bias and determine the credibility of information sources, distinguishing normal from abnormal findings, identifying the risks for abnormal findings, making adjustments about the significance of the data, distinguishing relevant from irrelevant data, identifying assumptions and inconsistencies, checking accuracy and reliability, and recognizing missing information. So it's important for you to critical think when you're collecting this data, okay? Characteristics of nursing assessments: purposeful, prioritize.
Am I ever able to jump in? Okay, so when she's talking about purposeful, you collect the information that you need, not information that you just happen to want to know about somebody. Okay, it has to have a purpose. There's a reason why you're getting the information, okay?
Prioritize, complete, systematic,
Systematic in order, right?
factual and accurate, relevant, recorded in a standard manner. 5 types of nursing assessment. Initial. Performed shortly after the patient is admitted. The purpose is to establish a database for problems and a care plan. Focused assessment. Data collected about a specific problem. Maybe the patient come in with a foot problem, a foot wound. So you just focus just on that area, okay?
So a patient will get a full exam, but subsequently, whatever you found, that is the thing that you're going to concentrate on. You will do a focus exam. So if somebody comes in and tells you they have a sore throat, you don't need to look at their feet. Right, okay.
Quick priority is a short and focused assessment. Patient is short of breath, so you would focus on the respiratory, getting O2 sets, assessing the lung, doing auscultations. Okay? Emergency, the patient may be in crisis and identified as having life-threatening problems. Chest pain, you want to immediately get an EKG. That's a life-threatening, could potentially be a life-threatening problem, right?
And when you're talking about assessing and something for an emergency situation, a lot of times, that's not, you don't have time to sit and ask the patient lots of questions, right? The goal in an emergency situation is to say is life-saving, all right? So in the other instance, you might be able to collect some data, but in an emergency, you may not. You may have to just do what you have to do to save that person's life.
Time lapse is scheduled to compare a patient's current status to the baseline data obtained earlier. A good example for that is like a home health patient that you don't see every day, but you know that if you saw the patient on your visit, that's something just is not like, maybe they're not alert and oriented, and they was before your last visit, right? So that's a change in condition. Anytime you find a change in condition, what do you do? Who said that? Who said notify the doctor?
I said document.
Document, but a change in condition. The patient's status wasn't at baseline. So you will notify the doctor. There is a change in condition, okay? Triage, screen the patient to determine the severity of the problem. ER nurses, they do severity. You went to the emergency room and you sat, now you mad because you didn't get to go to the back. But the nurse has triaged you and your illness might not be as severe as the patient that just came in. So that's called a triage, okay? So don't get mad when you sit in the emergency room. Patient-centered assessment, a health tool used by healthcare practitioners to assess patient complexity. Okay, tell whether the following statement is true or false. A nursing assessment duplicates a medical assessment by focusing on the patient's health problems. Who said false? Raise your hand.
Everybody, I hope.
No, everybody didn't raise their hand, so. Everybody?
I forgot you had this, so whoever you saw raising your hand, I forgot there's gifts to be had, you better remember to raise your hand.
Raise your hand.
Everybody raise their hand.
I saw those two raise. This row didn't. Yeah. Assessing the primary source of information is the patient, assessing, diagnose, outcome, implementing, evaluation.
So you see that S card, it never changes.
It never,
It'll
yeah.
always be the same.
It'll always be the same.
Anybody else here?
It'll always be the same.
Always be the same.
Let's see, is it coming up over here?
The way in which you do it.
Initial assessment performed shortly after admittance to a healthcare facility. Performed to establish a complete database for problems, identification, and care planning. Performed by the nurse to collect data on all aspects of the patient's health. Focus assessment may be performed during initial assessment or as a routine ongoing data collection. Performed to gather data about a specific problem already identified or to identify new or overlooked problems.
Right. Or something you first did an assessment and you didn't see something in particular, and then you go back and you see something new, right? Or something else has been added into what you saw before, something has, the patient has gotten something different, maybe got a nosocomial infection. They didn't come in the hospital with the pneumonia, but now they have it, right?
Does everybody know what a nosocomial infection is? Y'all do? Huh? Who said no?
Oh, sorry about that.
It's,
Somebody tell the class what a nosocomial infection
I can't hear you, can you speak up?
Infection contacted in hospital.
is. Infection that you acquired in the hospital.
Hospital. Quick priority assessment, short focus, prioritized assessment completed to gain the most important information needed first. Can flag existing problems and risks. Emergency assessment, we went over this. Perform
Oh, you wanna go?
timely?
Okay.
No. Okay.
Okay, so it's just really giving specifics about those
Yeah,
things.
that
Okay.
we've already went over.
Okay, so we did
Triage,
patient
uh-huh,
center,
patient
okay.
assessment, okay.
Question
Question number 2. Y'all ready? Everybody participating this time? Yeah, I see. Which one of the following assessments would be performed on a patient to gather data about his previous diagnosed liver cancer? A, initial assessment, B, focused assessment, C, emergency assessment, D, time-lapse assessment, and E, triage assessment. Which one do you think?
So some people say focus, some people say time lapse. Let's see the hands for the time lapse. So you got 2 for time lapse, and you got how many?
And now I got 3.
You got 3
4.
for time lapse?
4.
Okay, so you got 4 for time lapse.
Uh-huh.
How many for focus?
How many for focus?
Okay.
The focus have.
All right. So there's your rationale. Okay, so you can do that part while I hand out.
Health orientation, an assessment used to identify potential health risks and explore health habits, behavior, beliefs, and attitude that influence wellness. Developmental stage. In children, it is important to assess their milestones. When you're doing developmental stages with kids, you want to assess their weight gain, their physical growth, how independent they are in becoming self. That's if you have who has kids in here. You want your kids to reach their milestones, right? I mean that's developmental, the developmental stage that you want. You want to make sure they reach their milestones. Doing this, if you find out they're not, then that's when you want to get them help, right? Like speech, they might have a speech impairment, and you want to get has a speech impairment, so you want to get speech therapy involved. Yes, and that can correct the problem. Culture, know that culture is influenced by race, ethnicity, religious belief, and psychoeconomic factors. Culture, have you guys had cultural training yet? You read about, certain cultures, like if you have a patient that's a Jehovah's Witness and they don't take blood products. You guys know Jehovah's Witnesses do not take blood products. It's very important. So you might want to tell the doctor if he doesn't know, because 10 chances of 1 they don't know. But you might want to tell him before he enters the room, right? Need for nursing care, assessing for nurse care for maybe home health or terminal illness. The patient may have a wound and there's no one home to assist to do the wound. So you'll have to make sure you set up home health for that patient. Or terminal illness, you might have to contact hospice to assist them. It's always important to make sure you know what's going on with that patient in the community, because what you see in the community is definitely not what's going on in that hospital, okay? Always remember that.
Okay. Okay.
Objective data, observable, measurable data that can be seen, heard, or felt by someone other than the person experiencing them.
Hold on. Can you see my headache? I got a headache. Can you see it? Okay. Can you see my pain? Okay. If I have a scar on my face, you can see that. Okay. If I'm bleeding, you can see that, right? If I'm wheezing and huffing up, you can see that I have shortness of breath, right? Okay.
Subjective data, information perceived only by the affected person. Like she was saying, pain. She's telling you. Feeling dizzy, feeling anxious. Okay. Tell whether the following statements is true or false. A person rates his pain as a 7 on the pain rating scale. The rating is considered to be objective data. True or false? Ooh, everybody got that one.
Can't see his face.
Source of data, the patient, family and significant others, patient's records, medical history, physical examination, progress notes, consultations, report of laboratory and other diagnostic studies, report of therapies by other healthcare professionals, nursing and other healthcare literature. Tell whether the following statement is true or false. Most healthcare institutions establish a minimum data set that specifies the information that must be collected from every patient and use a structured assessment form to organize or cluster these data. True or false? True. They sure do. The skills of nursing observation. Determine the patient's current response. Determine the patient's current ability to manage care. Determine the immediate environment and its safety. Determine the larger environment, hospital or community. Nursing skill observation. Sometimes you're gonna find out that that patient is not safe. What do you do then? I can't hear you.
You have to report it.
You have to report it. You sure do. You have to report, even if it's the patient's daughter. You find out that patient is not safe, you have to report it. Okay?
Same with children.
Yeah.
If you do not report, you will be in trouble. And the last thing you want is not to report because you figure, the mother said the baby got a black eye because they fell down some steps, and you believe her, and you just, then the next day you see on the news that the baby died, right? So now then, somebody's gonna come back to you because you saw this, and you're gonna be in a lot of trouble. You must report. Unfortunately, sometimes the reporting is in error, maybe something does really happen. But the thing is, you cannot take the chance on somebody losing their life because you didn't do anything. You just have to roll with the punches if it turns out there's nothing there. But you don't ever want to not report, okay? Legally, you must.
You are an advocate for that patient.
I have a question.
Yes, ma'am.
Are dog bites also a mandatory report? They are in Arizona, that's why I'm asking.
Oh, I would imagine so. You
What'd
have
she
to
say?
talk to dog bites. 'Cause
Oh,
you have
yeah.
to-
Yeah.
Because a dog needs to be
Yeah,
quarantined.
yeah.
Uh-huh.
All of that.
Because, what do you call it, the shots, rabies shots,
Rabies.
there are a sequence of shots and they are very painful.
Yes.
How do you report something like that? Like, who do you report it?
Usually your institution has
Guidelines
a book
for
or
you.
whatever,
Yeah.
where you get the report things like that. Next slide.
Yes, ma'am. Nursing history. Nursing history captures and records the uniqueness of the patient. Example of information gathered in the history includes profile, reason for seeking care, usual health habits, cultural consideration, current state of health, current medication, allergies, perception of health status, developmental, family, environmental, psychosocial history, expectations of nursing, educational needs, personal resource, and potential for injury.
Expectation of nursing is important. What is your expectation of this visit? What are you hoping to have done? What do you want? I've seen patients, but when I tell you this stuff, I'm putting on my MP hat, but they come and they don't do anything that you tell them to do. Blood sugar still 900, blood pressure still off the chart, you get all kind of medicine, and then eventually I say, what is it that you want me to do? What do you want me to do?
Because you've given them the
Right.
medicine, huh?
Generally, nobody has an answer for it. But I had a gentleman who didn't take care of himself. And he got me good. I said, you know, if you keep coming here, why do you keep coming to these appointments if you're not gonna do it? He said, because you keep making me appointments. I was like, oh, well, okay, fair enough. You know.
And a lot of times, if you get the family involved, sometimes you can get the family, the grandchildren, they'll encourage the grandparents. Hey, grandma, it's time for this, or hey, and then the next time the patient come in, she said, oh, my grandson, he just gets on my nerve. He just wants me to take this. Well, blood sugar's better, eating better, right? So you might, sometimes you have to get the family involved.
And if you have somebody that doesn't have family and you want to talk to, like social worker at the hospital, and that most cities have some type of elderly resources and stuff like that, Meals on Wheels and that, that type of thing.
Right.
So you can get involved in that.
Appraisal of health, purpose of nursing physical assessment. Appraisal of health status, identification of health problems, establishment of a database for nursing interventions.
So this is your baseline. You come in and you do an assessment to see where you need to go next, right?
Assessment methods. Inspection, the process of performing deliberate, purposeful observation in a systematic manner. Palpitations. Palpations. Use of sense of touch to assess skin temperature, turgor, texture, moisture, as well as vibrations within the body. Percussions. The act of striking one object against another to produce a sound.
Listen to your abdomen and put my finger to your sounds of your abdomen.
Auscultation, the act of listening with a stethoscope to sounds produced within the body. You guys know what that one is, right? Vowel sound, breath sound. Problems related to data collection. Inappropriate organization of database, omission of pertinent data, inclusion of irrelevant or duplicate data, erroneous or misinterpreted data, failure to establish rapport or partnership, recording and interpretation of data rather than observed behavior.
Okay. That would be your bias, right? You saw this, but you determined that it was that, so you put in what you think it is, rather than just being objective and writing what you see.
Failure to update the database. That's why it's important to document.
If you don't document, what? It did not happen.
Validating inference. Performing a physical examination using proper equipment or procedures. Using clarifying statements. Sharing inference with other team members. Checking findings with research reports. Comparing cues to the knowledge base of normal function. Checking the consistency of cues.
Using clarifying statements. So what I understand you to say is, right, to make sure that you understood exactly what that person said. So if I understand you correctly, what you're telling me is, okay, so that you can be clear on what's being told to you.
When to verify data. When there is a discrepancy between what the person is saying and what the nurse is observing. When the data lacks objectivity. The patient tells you that he's not in pain, but you see him doing this and clenching. What that tells you? He's in pain. Documentation of data. Immediately give verbal reporting of data within a critical change in the patient health status is whenever a critical change in the patient health status is assessed. Enter initial database into computer or record in ink on designated forms the same day patient is admitted. Summarize objective and subjective data in concise, comprehensive, and easily retrievable manner. Use good grammar and standard medical abbreviation. Don't make up your own abbreviations. Whenever possible, use patient's own words. Patient stated, all patient stated.
Patient's blood pressure is elevated, blah, 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 blah. You discuss it with the patient stated, or states, I don't need this medicine, I feel fine. Put exactly what they said.
Avoid non-specific terms subject to individual interpretation or definition. Privacy, confidentiality, and professionalism. One of the nurse's primary ethical responsibility is safeguarding the patient's privacy of the patient. Nurses must be familiar with the institution policies on privacy and on requirements of the Health Insurance Probability and Accountability Act, which is HIPAA. That is very important. You must follow this guideline. Recently, the American Nurse Association and the National Council of State Board of Nursing united to provide guidelines on social media for nurses. You can't be, oh, this is my favorite patient, let's take a picture, click. No. No. You cannot do that.
Right, and remember the ladies in that hospital that got on there and put their pet peeves about patients?
Yeah.
I've never seen anything so stupid in my life. You might as well just go to the board of nursing and just hand it in your license.
Yes. No. Okay, and that's it. I'm completed. Thank you for allowing me. Thank you for allowing me to complete my teaching here. I really appreciate it. You guys are wonderful.
One day this will be one of you.